Well, I guess Republicans are now telling jokes because now they are trying to convince us that they are going to be the ones that fix healthcare for the American public. Just listen to Speaker Mike Johnson.
Who are you going to trust to fix healthcare? It's the Republican Party, because we have volumes of ideas on how to do this, on how to fix it, on how to drive costs down, and how to increase access to care and quality of care. And you're going to see all that vigorous debate. So
he really said that with a straight face, and he could barely say. You hear how much his voice is trembling, how nervous he is to try and make this promise that in 2 months has to come to pass. Because by December 31st, if you don't have your health care premium paid, you don't have insurance next year. That's just how it works. Now, before we jump further into this, my name is Jamie. This is the Opinion Caucus. Please do me the huge favor of liking, subscribing, following if you're enjoying the content. And let's jump right into this. So Republicans have bitten off more than they can chew in this entire ACA debacle. All they had to do is give Leader Schumer the 1 year of ACA credits that the Democrats requested, and they could have had this entire year going into the midterms to try and actually come up with a bipartisan plan that would actually help the American people. However, Republicans, as we all know, they don't have a healthcare plan. They have been saying for years, for a decade at this point, that they would put up their own plan. As far as we know, their plan has always been just remove Obamacare, and we go back to pre-ACA, where there's high-risk pools and where people that are women, have cancer, if you have long COVID 1 time, 2 times, you would be in that high-risk pool. You possibly, most likely, would not be able to afford getting health care. People keep asking, why is healthcare expensive? Healthcare is expensive because now everybody is afforded health care. Before, they could just say, no, you got cancer, can't do it. You gave a baby. You're birthing children now, women? No, you can't do it. You can't do it. So just listen to Speaker Mike Johnson. When we told y'all, we should have stood firm in the Senate because they have no intentions of fixing the current healthcare system that we're in. Just listen to them.
And you're going to see all that vigorous debate. So the answer to your question is, am I going to guarantee a vote on ACA unreformed COVID-era subsidies that is just a boondoggle to insurance companies and robs the taxpayer? We got a lot of work to do on that. The Republicans would demand a lot of reforms before anything like that was ever possible, and we have to go through that deliberative process.
We're wondering, what are these reforms? What are these reforms? This is Eric Daughtry's post. Now, I don't recommend going to him as a source of fact because he's nothing if not extremely of Donald Trump's ass crack. Now, this is what he had to say. President Trump has the Democrats totally cornered on Obamacare. And this is what Donald Trump said earlier today.
Exact opposite, with the biggest increase of healthcare in any country. It's a disaster. And I'm calling today for insurance companies not to be paid, but for the money, this massive amount of money, to be paid directly to the people of our country so that they can buy their own health care, which will be far better and far less expensive.
So essentially what he's talking about, what Republicans have been floating around, is like there's $2,000 rebate check that will only go to people that have less than $100,000. We all understand that they're trying to telegraph to you. They're trying to find a way to move this tier of money because in front of the Supreme Court, they are currently listening to a case which potentially would have Donald Trump have to pay all that money back to the American public. So now they're trying to figure out how can we finagle our way out of this? And they're thinking about giving $2,000 to each person underneath $100,000. But here's the key fact. They're trying to push that together with, okay, this is what the money will give you, and you'll figure out what you do with your health care. Please tell me, do any of y'all have health care that's $2,000? My health care, I'm a 26-year-old woman. My health care by itself is what, $450 something a month. With the ACA credit, I only pay like $20. Also added on dental and vision because I wear glasses. So please tell me, who is going to be able to get health care for $2,000 for the entire year of 2026? Y'all are trying to lose the plot. He's trying to give you a little bit of change here while he takes away a big chunk of change for himself. Because let's not forget, Donald Trump had $40 billion he could find to bail out Argentina. But he does not have that same exact money to make sure that you have health care. That seems kind of weird, if I must say so myself. And we all know what this goes down to. They don't understand the way healthcare works. Just listen to Dr. Rogers, who's supposed to be this big person who's going to help make the healthcare so much more affordable.
I want to turn to talk about fraud just a little bit more. Get this, 35 to 40% of Obamacare recipients that are enrolled in Obamacare never file a claim. Let me say that again. There's 24 million people on Obamacare. 35, 40% of those people never file a claim. These are ghost people. They don't even know they're on Obamacare. They've been
You heard that, right? He said that 20 to 30% of people on Obamacare never file a claim. Duh. Of course you don't file a claim because guess what? The hope is you don't need it. It's health insurance, like car insurance. You pay your car insurance because you want to drive your car. But let's say you ever get into that unfortunate accident and your car is totaled or needs to be fixed, you have insurance to cover the costs. The same thing with fire insurance. God forbid your house caught some fire. However, if it does, you have the fire insurance to cover the cost of your house if it caught on fire. Republicans have no idea how the system works. No idea. Just listen to Representative Fernandez explains what it means, what it meant to be on healthcare pre-ACA.
To go with the fact that, Representative Roy, who came and left so quickly, he was talking about cancer and how he's a cancer survivor. I'm a cancer survivor. And he was talking about how the Affordable Care Act is so bad. But you know what? I'm a cancer survivor. And so if it wouldn't have been for the Affordable Care Act, I would not be able to get insurance. Because it was a pre-existing condition. You know what else I am? I am a woman. And because I was a woman and could have had babies, I would have also been a pre-existing condition. And these are the benefits of the Affordable Care Act. And the list goes on and on about why that Affordable Care Act makes sense. But what we also need to make it be is affordable. And we had a hearing. I'm the chair of the Democratic Women's Caucus together.
And I don't think Republicans understand, like before the ACA, you could not get insurance, some women, if you had kids, and let's say you had a C-section. Because prior, when you had a C-section, you would have to have a C-section every single time. Now, technology is a little bit better, so you might have a C-section one time. You might be able to do a natural birth the next time. But that was considered a pre-existing condition. They did not want to pay for that surgery of you having a C-section. They didn't want to pay for that extra day or two you would have to be in the hospital after that surgery. Like, people are acting like we don't remember when healthcare used to be a non-profit business before it became a for-profit business. And that is when the prices exploded. Those are all things that happen underneath Republicans. They are the ones who keep pushing for profit this. Let's get the government out of this. Let's have less regulation. This is when you have massively expensive healthcare. There's ways to make it more affordable. Raise the taxes on the top 1-2% that can afford to subsidize the cost for everybody. We could have healthcare for all. And not only would it make it cheaper, you would put more money into the economy because guess what? Since low-class families and middle-class families aren't having to shell out that money every single month in healthcare, it can go back into the economy. It would help the stock market boom, which would help that 1% make even more money since everything is about being a capitalist in this economy. We're the only first world country. We're the richest country in the history of the world. And we're the only country that does not have healthcare guaranteed to its citizens. Canada has it. The UK has it. Switzerland has it. Even Israel has healthcare for all their citizens, something that we pay for them. Isn't that about a bitch, right? But we can't afford it. But we can pay for a whole nother country to have it. It's completely crazy. And we all know where they're going to. They want to add on high-risk pools. We've been hearing this over and over and over again from Republicans in all parts of leadership.
You're going to have to create high-risk pools again. Just go back where Minnesota was before.
Bringing back high-risk pools, which have been outlawed under the Affordable Care Act.
Again, it's the faulty design. With that,
respectfully, Senator, if I had tested positive for Huntington's disease, what would my option have been then? Again, I wouldn't have had an option.
So what we would have done is high-risk pools. We would have.
But I think this is the reason why Democrats were so freaking upset with our leadership in the Senate. Because it all comes back down to this. They have no intentions of fixing the system. They're just trying to find a way to make the top 1% even richer and expanding the inequality gap in America. There's no reason why we should not have guaranteed free healthcare. There is no reason why that the Senate should have caved in this ask, especially when the Republicans have no plan, none whatsoever. We all remember in 2020 during the elections between Donald Trump and Biden when he tried and come on CBS with this entire big book of his healthcare plan. And now we're realizing, oh, they're still in the concept and ideas phase, right? We all remember this. Let me see if I can pull it up. Do y'all remember this? This is Forbes. This is from 2020, October 21st, 2020. You remember this? When Donald Trump gave this big ass book at the end of his 60 Minutes interview, and the front page was blank. This was his healthcare plan. He did the whole little walkout with Kayleigh McEnany presenting it like it was a plan, and it had nothing in the book. Because this is the antithesis of the Trump administration's healthcare plan. Nothing. This is the reason why we were like, please do not cave. They have no plan. Just listen to Representative Figures explain exactly where we're at right now.
And for what in the end? What were Republicans willing to give in the end? Nothing more than a handshake deal to take a future vote on extending the health care subsidies, when we all know that that future vote is the equivalent of asking two wolves and a chicken to vote on what's for dinner. It is dead on arrival.
But yes, just like Representative Figures said, just like asking two wolves and a chicken what's for dinner, it's dead on arrival. We all know they have no plan. They have been playing in our faces for years about here's our plan, when we all know in reality they just want to go back to pre-Obamacare. They want to go back to high-risk pools, as we saw on that compilation. They want to go back to when people like me, women who had children, are considered, oh, you're risk. You've had a kid. At the same time, they're making it where we can't even plan our families the way we want to. They want to make it where people that have COVID, like 90% of Americans, are now considered high risk and have to pay exorbitant premiums or just get completely blocked from getting any kind of health care to begin with. But y'all tell me what y'all think about all this in the comments. Remember, y'all, please do me the huge favor. Like, comment, subscribe. We're trying to get to 500 subscribers by the end of this month. I know a little ambitious because we're only at 311 right now. But like I said, y'all tell me what y'all think about all this in the comments, and I'll see you on the next one.